So we have a second confirmed novel coronavirus case in Victoria. As you know, we had an earlier case, a man who's still stable and in hospital, but we now have a new case, a man in his 60s, a Victorian resident who became unwell on the 23rd of January, subsequently tested through his general practitioner, and he's been referred to Monash Medical Centre where he's been assessed as well. So he's returned home and is in isolation at home. But he's a second case in Victoria. He has family who we need to follow up as close contacts. They are undergoing ongoing monitoring. Some have had symptoms, but no one has returned a positive test to date, but they'll remain under monitoring by the department. It does bring home the issue that we need to bear in mind that anyone coming out of China, and in particular from Wuhan or Hubei province, is at not insignificant risk of developing illness with coronavirus. And so we do urge people who have returned from that province in particular to be aware of the symptoms, flu-like illness and fever, but also including fatigue, to consider that they might have coronavirus illness and to call ahead to an emergency department or their general practitioner and have testing if appropriate. The gentleman in question was mostly at home and had isolated himself when unwell, but he did go out to a restaurant called the House of Delight for a short period of time. That restaurant has been followed up, and for those who were there at the same time, whose contact details we have, we are following up. But obviously that restaurant is okay to go to now. People don't need to avoid that area or indeed anywhere else where people have been but are no longer, even if they'd been infectious at the time. He was there with his family, so those who are in the closest proximity to him are the same close contacts that we're monitoring normally. With regard to the national consensus on those returning from Hubei province, you may have seen the Chief Medical Officer and Minister Hunt announce that really there's now some very preliminary and pretty scant evidence of potentially people before they have developed symptoms potentially transmitting illness. In particular, there's some evidence from Germany about someone who may have transmitted to 4 other individuals before she herself developed symptoms and became diagnosed with coronavirus. And so there's a very precautionary approach that we've decided to take nationally. All chief health officers are now recommending that for those who have returned from Hubei province, so includes Wuhan, the city, but the province in general, must self-isolate or self-quarantine for 14 days after leaving that province. For the rest of China, case numbers are really small when you consider a population over 1.3 billion people. The recommendation is not to quarantine. Obviously, we still want people to have awareness of the symptoms and to seek appropriate medical advice if they do become unwell. But for those who are returning from Hubei province, we are saying stay at home or stay in another setting where they can remain isolated from others and not to receive visitors. Obviously, if they need to seek medical attention, they should do so. That does have implications, obviously, for aged care settings, healthcare settings, childcare, prisons, where people who may work there should not return until 14 days after leaving that province. For other parts of China, we are saying there is no need to self-quarantine. We are updating and reviewing evidence on a daily basis. The Communicable Disease Network Australia is meeting every day. All chief health officers are in contact every day. As new evidence comes in, we will make changes that affect policy. We make no apology for that. I think that's the critical role that public health expertise should play in Australia. If there is evidence that transmission without symptoms extends for a longer period before people become unwell, we will update policy accordingly. If there is evidence that that's a significant route of transmission, we will let everyone know. But at the moment, our understanding is that people with symptoms are absolutely those who we're most concerned about in terms of transmission, but there is some limited evidence that people without symptoms can transmit to others, and so we're taking a very precautionary approach for those returning from Hubei province.